My first question was just kind of a broad opening one. If we're talking to people who are unfamiliar with play therapy, or perhaps have heard of it but don't really understand the research behind it and the evidence behind it, how would you describe it to those people?
Sure. So, play therapy is a method of counselling with children that's been around for a really long time, and it's growing in popularity, acceptance, and use in Australia. So, defining it in a more astute way, I would probably say that play therapy is an evidence-based, developmentally appropriate counselling method for children that uses play-based interventions facilitated by a therapist trained in play therapy. So it is a broad industry, just like any industry in counselling is. And just like there's lots of approaches to talk-based therapy with adults, there's a lot of different angles and approaches and methods within the play therapy school of practice as well. So there's very directive methods where we are asking children to maybe draw a picture of their family, would be an example of a directive play therapy intervention, through to very much less therapist directed or directive forms of play therapy, which would be child-led or child-centred or non-directive approaches, where we're really inviting children to play in the way that's just right for them. And there's particular techniques and methods that encourage children to do that and support them to do that. So much like if you were to sit in a counselling session with an adult who was having CBT or DBT, that would look really different to them having psychoanalysis or doing gestalt therapy or person-centred therapy. So there's an array, just like in adult counselling methods, an array of play therapy approaches in working with children as well. So there's no one definitive, I don't believe there's a one-size-fits-all play therapy approach for every child and every presentation. And I also genuinely believe that not every child and not every child presentation is suitable for play therapy. So I think it really is important to do a careful assessment with parents or carers outside of contact with children and prior to, before deciding that this will be the most opportune intervention and then arranging with them how that's going to look.